This epidemic is the first one, I think, since World War II in our country, in modern American history anyway, that starts not with drug traffickers and drug gangs and street dealers, but really this one starts with doctors.
Sam Quinones traced the path of America's opioid epidemic in his best-selling book, Dreamland. A noted journalist, Quinones was at NACo's annual conference in Long Beach to discuss what he's learned about the crisis. County News sat down with him to discuss his reporting.
Very, very intensely promoted by pharmaceutical companies to say that we now know, science now knows that these pills, when used to treat pain, are non-addictive or virtually non-addictive. And this was something everyone wanted to hear. Patients wanted to hear it because it was easy pain treatment. Doctors wanted to hear it for the same reason. Pharmaceutical companies wanted to parlay that idea because, you know, it helped them sell pills. As you get this almost complete buy-in on the part of hospitals, doctors, medical schools begin teaching it, part of their curriculum. And all of this creates this massive kind of like opiate juggernaut that is an enormous amount of pills out there sloshing around. 10 years prior to all that, there was a change in our heroin market too. All our heroin begins to come from the eastern United States, gets all its heroin from Colombia, the western from Mexico, and eventually the Mexican cartels grow in such stature that basically all the heroin really then comes through Mexico. It may be originating in Colombia, but it comes through Mexico. The market is for heroin that's cheaper than ever because it comes from only 2,000 miles away rather than like 12 or 15. It's more potent. It's not cut as much. It doesn't change hands as much each time heroin changes hands. Normally people cut it, becomes more diluted. And it's more prevalent, easier to find. It wasn't really until we created this enormous new population of opiate pill addicts that issue became important. All of a sudden, whoa, yeah, now it becomes important where that heroin's coming from because it's cheaper than ever. And so people are taking, they get addicted to these pills, especially with OxyContin. Their tolerance rises and rises, becomes far more expensive than they can afford. And they look around for something that'll take, take its place. And the thing that supplants it very easily and very quickly and very cheaply is this cheap Mexican heroin. This is not an inner city epidemic. This is really areas, rural areas, suburban areas, small and mid-sized towns. This is in every county of the country, It's a quiet epidemic, and that is also crucial to this because it's just less violent. And that's part of why it's spread. First of all, it's doctors prescribing pills, and no one really understood that this would lead to heroin, I think. And doctors are well respected, and everyone knows most doctors want to do the right thing. They're not devious folks. At the same time, as parents began to lose children, they ought to have been the vanguard of getting this word out. But in this one, too many parents, so many parents, were mortified, were ashamed, were embarrassed that their kids died with in this way, or in a bathroom, a McDonald's bathroom or something, So they kept quiet too. And when you don't have that, you don't have political pressure from below. You don't have a lot of awareness. You don't have a lot of focus put on. The media finds it easy to ignore. For a long time, nobody did these kinds of stories really. And that is, of course, what has radically changed in the last year and a half. Now you don't see that. Now you see parents putting in obituaries of kids. Must be very difficult for those parents to do that. But it's a healthy thing. It's a healthy thing for them. It's a healthy thing for the country, for the community. You see Facebook and stuff like this. All these groups on Facebook. You see marches now. And so now it's developing. I wouldn't say it's even there yet, but it's developing that groundswell of notice and public awareness that it ought to have had for, I think, 10 years. Government has been the thin line between us and total opiate mayhem for the last 20 years, and that's not a lie. That is absolutely what I believe to be the truth. They were the ones fighting it when no one wanted to talk about it, when no one cared, and sometimes we get threatened or sued or threatened with lawsuits. No, there's a huge role. There's a huge role for government to play in all this, and county government, especially because county government is the level of government that interfaces most directly with the opiate epidemic. Criminal justice, jails, county hospitals, coroner, etc. You name it, on down the list of county services. Most of them will interface with the opiate epidemic in one way or another. And I think the opiate epidemic is one of the real forces for change in America. It's changing how we think about addiction, changing how we think about crime and punishment and courts and all that. One place I think it could really be enormously beneficial over the long run is if it changes our way of thinking about how we do jail. Jails are parking lots, right, for people, and they're boring, predatory, tense, stressful. They're anything but nurturing, and so people come in, and an addict may come in and say, what am I doing with my life? Oh my God, detox. He starts to think rationally for the first time in maybe a year or two, maybe. And now he's in jail, girlfriend left, mom won't take his collect phone calls anymore. And it's into that person who's ready to reassess what he's been doing and ready to maybe opt for a new path. We throw him into a place where it's survival of the fittest, and it's everyone pitted against each other. And the best you could say is it's boring and people sleep and watch TV all day. That's the best in most jails anyway. And in some jails, particularly in Kentucky, what they're doing is they're transforming pods, 70, 100 people units, whatever it happens to be, into full-time, 24-hour, opt-in, it's opt-in, rehab clinics. And it's not that expensive to do. It's actually quite cheap. You've already built the facility. And so it's just a new way of orienting and hiring the right people to run it, and not viewing it as a parking lot, but as an opportunity to transform, or give an opportunity to transform themselves to people who may then, at that very, very moment, be looking for it. It is not a silver bullet. There is no silver bullet to this stuff. This is like a lot of different solutions all tried in conjunction. That's where you get to progress, I think. And so we need to think in terms of all these different solutions, but a big one is giving another look at how we do jail. Very important thing too. And if that's what comes out of this, then we actually may be, who knows, I hate to say it, but very thankful to the opiate epidemic, that it actually kind of changed something into something from being a negative, which I think all jail is basically in America, to something that could be almost a positive.